Welcome, everyone. Thank you for viewing our recorded webinar titled Introduction to the Health and Supportive Care Providers Oversight Authority, or HSCPOA, Registration and Oversight of Personal Support Workers in Ontario. Your presenters for today will be myself, Kathy Wilkie, HSCPOA's Chief Executive Officer, and Deborah Cohen, HSCPOA's Registration Manager. We will cover an overview of HSCPOA, our outreach and engagement activities, how to apply and become a PSW registrant, support for employers of PSW, HSCPOA's next steps, and our call to action for PSWs and system partners. Answers to questions from all the three live HSCPOA 2024 summer webinars have been incorporated through this recorded webinar. Under the Health and Supportive Care Providers Oversight Authority Act 2021, a new regulatory approach is being implemented by the Ontario government for the oversight of individuals providing health and supportive care services in Ontario, beginning with personal support workers. This model of regulatory oversight is similar, yet somewhat different from health regulatory colleges in Ontario, and those differences will be noted on a subsequent slide. The work in implementing the HSCPOA Act will be carried out by the Health and Supportive Care Providers Oversight Authority, which was established by the Government of Ontario for public protection. HSCPOA will begin registering and providing oversight of PSWs, and other classes of registration may be added in the future. The overarching mandate is public protection to ensure that PSWs registered with HSCPOA deliver safe, competent, ethical, quality care to recipients of their services. Advocacy work for the PSW profession will continue with OPSWA, the Ontario PSW Association. In June through October 21, the HSCPOA Act was introduced and a limited number of provisions were enacted to allow for organizational governance and for HSCPOA to carry out its objects in the legislation. From November 2022 to October 2023, an interim board of directors was appointed and the CEO was hired to establish operational infrastructure. There was an election to establish the full board, made up of government-appointed and elected board directors, both of which included competency-based appointments. There are no PSWs on the board, but PSWs will be represented on the PSW Advisory Committee. From December 2023 to January 2024, the proposed regulatory framework was posted on the provincial government's regulatory registry for comment. Supporting webinars were provided to system partners by the Ministry of Health. From February through May 2024, the regulations were developed after consideration of the regulatory registry comments and passed by the government in late May 2024. Simultaneously, HSCPOA has been building organizational capacity in anticipation of PSW registration and oversight. From June and anticipated to go through November 2024 and beyond, HSCPOA has been conducting outreach and engagement with system partners to enhance awareness and to promote PSW registration. We are carrying out the work to prepare to begin accepting applications in the fall. A call for expressions of interest will also go out in the fall 2024 to convene the PSW Advisory Committee, which will be made up of PSWs, employers, educators, associations, unions, caregivers, recipients of PSW services as per the PSW Advisory Committee regulation. On December 1st, 2024, once the regulations come into force, all PSW registration pathways will open. The PSW Advisory Committee will be established and membership subject to board appointment. Many of you may have seen the Ontario government announcement on June 4th, 2024, that the regulations under the HSCPOA Act will come into force on December 1st, 2024. These regulations outline much of what HSCPOA is required to do under its public protection mandate, including the date we can begin to register eligible PSW applicants. We will begin registering qualified applicants on December 1st, 2024, and will communicate when we will start accepting applications in the fall once the online process is in place. These 9 regulations listed on the slide under the HSCPOA Act are available publicly on the Government of Ontario's e-laws website. A future regulation is likely to come in to force or will focus on quality assurance. Through the HSCPOA Act and regulations made under this Act, HSCPOA has several requirements to fulfill. They are termed objects in the Act, including to administer the Act and the regulations made under the Act, including overseeing their enforcement, establish and maintain educational and skills-based qualifications for each category of registrants, establish and maintain one or more marks or other types of visual identifiers for use by registrants that can identify registrants to members of the public, promote the provision of safe, competent, ethical, high-quality health and community care services by registrants to members of the public. Establish and maintain codes of ethics applicable to each class of registrants in relation to the health services they provide to members of the public. Educate registrants, employers, and members of the public about matters relating to this Act and the regulations. Advise the minister at the minister's request on certain policy matters related to the administration of the Act and operation of the HSCPOA organization, and carry out any other duties or powers assigned to it under this Act. The components of HSCPOA's regulatory framework are listed on this slide. In alignment with the registration regulation, HSCPOA has established the requirements for registration, and there are more details to come during the Pathways to Registration section of this webinar. Once PSWs are registered, HSCPOA will have an online public register, easily accessible via the main website page for the public and other system partners to search for a HSCPOA registered PSW. There is a code of ethics that will hold HSCPOA registered PSWs accountable and will lay the foundation for any complaints and conduct matters. There is a complaints, discipline, and appeals process, and HSCPOA is drafting information for our website, including an online complaints form, reporting forms for registrants and employers, FAQs about our processes for the public and registrants, as well as a flow chart that outlines the steps involved when reviewing a complaint. There is a requirement to develop a formal PSW advisory committee and the rules for this committee to help inform HSCPOA in its work, since as per the HSCPOA Act, the board doesn't have PSWs. Registrants may use the HSCPOA PSW visual mark on identification and other promotional materials. HSCPOA has developed a PSW visual mark guideline document available on our website to assist registrants and employers with usage. Funding for therapy and counseling for complainants as part of the complaints process as applicable. HSCPOA is aware that there were 2 previous attempts in Ontario to create registries for PSWs that were unsuccessful. These differ significantly to HSCPOA's mandate because there is overarching legislation now in place through the HSCPOA Act. There are also several regulations under the Act that specify the legal objects that HSCPOA must carry out. HSCPOA has the regulatory framework that previous registries were not provided to regulate, oversee, and hold PSWs accountable in the interest of public protection. HSCPOA's public register includes information like other regulated health professions, including registrant information, where you can find the name, gender, languages spoken, and employment details of every HSCPOA PSW registrant. HSCPOA takes the privacy of our future registrants very seriously and is committed to protecting this information. No personal contact information will be included on the public register, such as a home address or telephone number. Registration status. The public register will specify whether a PSW registrant is active or inactive, and if registration has been suspended or revoked, or has any terms, conditions, or limitations. Conduct history, a summary of any complaints and disciplinary actions taken by HSCPOA and other regulatory bodies, as well as relevant charges of convictions for certain offenses that relate to the safe provision of personal care services will be included. Following initial registration on December 1st, 2024, a public register of all HSCPOA registered PSWs will be made available at HSCPOA.com. Anyone can search and confirm whether someone is registered. Employers may wish to require registration with HSCPOA for its PSWs and can incorporate this requirement within its human resources policies. HSCPOA is also implementing an employer directory whereby employers can view who is registered within their organization and download a report. Information would resemble what's on the public register, but employers can more easily get a list of all their employees and download a report for their records, rather than having to confirm each individual PSW employee on the public register. If you haven't already done so, please subscribe to receive HSCPOA news and important information, which will include a future email targeting employers with instructions on accessing the employer directory. Please note that this directory will only be accessible after December 1st, 2024, once the regulations come into force and we begin registering qualified PSWs. For now, registration is voluntary and PSWs can continue to work in Ontario without being registered. The Ministry of Health was deliberate in making registration with HSCPOA voluntary. The rationale for voluntary registration is to avoid any unintended consequences or disruptions on the healthcare system and the PSW supply in Ontario. In the future, the government may decide to make registration mandatory, which would require amendments to regulations and would likely incorporate a transition period. We have seen this in other provinces in Canada who register personal care providers, whereby registration is mandatory to work in publicly funded programs, and employers expect all PSWs to be registered. We are hearing from the PSW Professional Association and PSWs themselves, employers, and educators that they want regulation. While some may be disappointed that PSW registration is not mandatory, there is still value in a voluntary regulation approach. Refer to the FAQs for more information on this topic. The best way to demonstrate support of the regulation of PSWs in Ontario is by becoming registered on December 1st, 2024, and encouraging others to register. PSWs in Ontario can be confident and proud to register. Becoming registered shows a PSW's commitment to safe, quality, ethical care. Registration doesn't have to be mandatory to demonstrate this. We encourage PSWs in Ontario to be a trailblazer and become registered early and help inspire others to do so. Together, you can help shape the future of PSW regulation in Ontario. There are many benefits of registration with HSCPOA. It builds trust and respect. Being registered with HSCPOA shows a PSW has met qualifications for registration and that they are committed to protecting the public by delivering safe care. It demonstrates accountability. When a PSW is registered with HSCPOA, it shows they are accountable to provide safe, quality care like other regulated health providers, including nurses, dietitians, occupational therapists, and physiotherapists. Registered PSWs stand out. Being registered differentiates a registered PSW from unregistered PSWs who are not accountable to an oversight body. There are more employment opportunities. Being on HSCPOA's public register means employers and the public can easily find qualified and registered PSWs. Employers may prefer to hire HSCPOA registered PSWs as they know these PSWs are accountable to HSCPOA for quality care. Employers will also have access to a portal to easily download a report to identify which employees are registered PSWs. PSWs can use the HSCPOA visual mark. Colleagues, employers, and recipients of PSW services will immediately recognize someone as a PSW registered with HSCPOA. It's free and voluntary. There's currently no cost to apply and become a registered PSW. There are differences from other regulatory bodies, for example, other health regulatory colleges in Ontario, that many people viewing this webinar may be familiar with. Initial oversight focus is PSWs, but other health professions may be added in the future. Registration is voluntary, and there are no application and registration fees initially. Registrants will be identified by a HSCPOA PSW visual mark to show their commitment to quality care. A guide to help educate PSWs, employers, and other system partners about usage of the HSCPOA PSW visual mark is available on the HSCPOA website. There is no protected PSW title. Registrants do not have a defined scope of practice except for delegations of controlled acts. Much of what a PSW does is in the public domain activities. And registrants cannot be on HSCPOA's board as indicated in the HSCPOA Act, but the ministry is taking an innovative approach that differs from the self-regulation model we see with other regulated health professions in Ontario. Instead, the HSCPOA Act prescribes registrants and others, such as PSW employers, educators, a variety of associations, and union reps, to be represented on a HSCPOA PSW advisory committee to provide advice to the board. There is great value in the creation of HSCPOA. HSCPOA recognizes the important role that PSWs play in the Ontario healthcare system, and that they are respected healthcare providers working alongside other regulated health professionals. It's focused on public protection. Through regulation, the public and system partners can be confident that registered PSWs have met the registration qualifications to deliver safe, competent, ethical, quality care to recipients in hospitals, long-term care facilities, retirement homes, home care, or other environments where care is provided. There is improved transparency of the public regarding PSWs through the public register, which is like other regulated health professionals. HSCPOA strengthens health human resources oversight by ensuring quality care, consistency of education, and training of PSWs. Registrants of HSCPOA gives assurance to employers and the public that registered PSWs have met the minimum level of education and training, helps employers find registered PSWs, demonstrating quality of care. While registration is voluntary, HSCPOA PSW registrants are committed to safe, ethical, quality care. HSCPOA has and will continue to engage and educate system partners such as employers, educators, the PSW Association, and other healthcare system partners about the role of HSCPOA and the pathways to registration. Our communication initiatives include website content, information sheets and handouts now available on HSCPOA's website, and I'll share some examples in a moment, videos that are in progress, webinars such as this one and others targeting specific groups and topics, our e-newsletter, and please subscribe via the HSCPOA.com homepage, and speaking engagements will be handled on a case-by-case basis. There are 10 info sheets or handouts that have been developed so far, and they're posted on the HSCPOA website to enable sharing consistent message with PSWs and other system partners, so PSWs know what to expect. On this slide, there are 3 info sheets. First one about HSCPOA, how can I apply to register, and how registering benefits you. This slide lists the next 3, which are HSCPOA's PSW visual mark. A usage guide, as I mentioned, is now published on our website, HSCPOA Public Register, and HSCPOA Code of Ethics. And this slide lists the next 4. Employers, why encourage PSWs to apply? Educators, why PSW graduates should apply? System partners, together we're stronger. And the oversight body versus the association, what's the difference? You can help HSCPOA build awareness. Please convey the benefits of becoming a registered PSW to your colleagues and others within your network. If your organization employs or educates PSWs, consider including a link on your website to HSCPOA.com. Contact HSCPOA if you're interested, including an upcoming newsletter article. We can provide content. And please share HSCPOA's information sheets and handouts within your network. Consider ways to distribute them widely, such as handouts for upcoming events as appropriate. And these info sheets were previously shared on the slides. And you can access them on our website by going to About HSCPOA Publications. I'm now going to turn the presentation over to Deborah Cohen, who will take us through the pathways to registration.
Thank you, Kathy. There are 4 pathways to registration. Path 1, graduates of Ontario PSW education. Path 2, employed as a PSW in Ontario or the Legacy Grandparented pathway for those with work experience. Path 3, mobility on an equivalent PSW registry or directory in Canada. And Path 4, competency assessment. The application process will be entirely online. A link to apply will become available in November 2024. Applicants will be able to upload most of the documentation to their online application form, which will be accessible via computer, tablet, or phone. The application process will walk people through the steps. It can be started and saved for later as needed, and a detailed application guide will be available. As mentioned previously, there will initially be no application and registration fees as the Government of Ontario is funding the beginning stages of HSCPOA's registration process. If in the future fees are charged, we will consult on this and they will be proposed as low as possible on a cost recovery basis. We will also have information webinars and recordings specific to the registration process so that applicants and other system partners can visually see how to apply. More details about these 4 registration pathways will follow. All applicants must meet the registration requirements, which includes completed recognized PSW education or PSW work experience. Language proficiency, as per HSCPOA's language proficiency policy, and good character, which includes a criminal record check, attestations and declarations on the application form, and letter of good standing if an applicant is currently or was previously registered elsewhere in another profession or occupation within or outside of Canada. Note that there is no licensing exam or authorization to work in Canada requirement for registration with HSCPOA. Path 1 includes graduates from an Ontario PSW education program that meets the requirements set by the Ontario Ministry of Colleges and Universities, designed to prepare an individual to provide personal support services. This includes Ontario PSW education programs completed on or after July 1st, 2014, that are offered by Indigenous institutions, district school boards, colleges of applied arts and technology, and private career colleges. If an applicant completed their Ontario PSW training before July the 1st, 2014, they may be eligible to apply through Path 2, employed as a PSW in Ontario. Path 2, employed as a PSW in Ontario, is the legacy pathway that recognizes applicants who have been employed as a PSW in the preceding 3 years before the date of application to HSCPOA. The PS will complete an employer confirmation and verification of skills as a form. The employer must be on the prescribed employer list in the registration regulation, long-term care homes, hospitals, retirement homes, community health service centers, and publicly funded home care agencies. The list of employers was determined by the Ministry of Health and is designed to ensure that there is someone able to verify that the PSW applicant has a set of skills that is comparable to recognized PSW Ontario educated graduate. There are 2 options within Path 2. Those with or without any formal education but have worked as a PSW or equivalent in Ontario with at least 600 hours of work experience over the 3 previous years prior to the date of application with HSCPOA. Alternatively, those with formal PSW education that was at least 600 hours and they have been employed as a PSW or equivalent in Ontario in the 3 previous years, but haven't yet worked a minimum of 600 hours, can also apply through this pathway. Please note that Path 2 will only be open until December the 1st, 2027. If an eligible applicant does not become registered under Path 2 during this time, they will be required to complete recognized Ontario PSW education and apply through Path 1, or if they are eligible, apply through one of the other registration pathways. HSCPOA is committed to assisting employers during the application and registration process. This is facilitated through support in completing the employer confirmation and verification of skills as a PSW form. While non-publicly funded home care agencies which contract PSWs to work in institutions like long-term care homes or other types of settings are not on the prescribed employer list in the registration regulation, they can work with the most appropriate person, for example, the PSW supervisor in the PSW work setting, to complete the form collaboratively. HSCPOA is committed to ensuring that all those eligible for registration have a means to do so. Those working in private practice without a prescribed employer can seek registration through Path 1, if applicable, or by additional work in an organization that is under the prescribed employer list in the registration regulation. As mentioned previously, the employer directory will help support employers to easily access a list of their PSW employees who are registered with HSCPOA. HSCPOA also has a PSW visual mark usage guide on our website that provides guidelines for usage for PSWs and their employers. Applicants who are both graduates from an Ontario PSW program on or after July the 1st, 2014 that meets the requirements set by the Ontario Ministry of Colleges and Universities designed to prepare an individual to provide personal support services and been employed as a PSW in Ontario in the past 3 years should apply through Path 1, completed Ontario PSW education, to recognize their education program completion. Path 3, labor mobility, includes applicants who are currently registered with the British Columbia Care Aid and Community Health Worker Registry, the Alberta Healthcare Aid Directory, or the Nova Scotia Continuing Care Assistant Registry. Applicants must have also provided personal support care in the 3 years before applying for registration with HSCPOA. Applicants who have not provided care in the previous 3 years are not eligible for registration through labor mobility, but can gain employment as a PSW in Ontario and apply through Path 2, employed as a PSW in Ontario, while it's offered until December 1st, 2027, or undergo a competency assessment. Applicants are eligible for Path 4, the competency assessment, if they have completed a personal support services education program outside Ontario that was a minimum of 600 hours in duration, including both class time and practical experience time. Applicants are eligible to complete a competency assessment if they do not meet the eligibility requirements for one of the other registration pathways and they do not yet have Ontario PSW work experience in the last 3 years. This may include applicants who are internationally educated or trained outside of Ontario within Canada and not eligible for registration through the labor mobility pathway. The competency assessment is currently in development and will determine if an applicant who completed education outside of Ontario has the necessary education and a set of skills that is substantially equivalent to someone who has completed an Ontario program that met the requirements set by the Ontario Ministry of Colleges and Universities to issue a PSW certificate. With the absence of formal entry-level competencies for PSWs in Ontario, which may come in the future, these PSW standards serve as a framework for assessing minimal competence. Note that HSCPOA is currently considering a policy to recognize internationally and domestically educated nurses as eligible for registration without undergoing a competency assessment. This policy is still pending and will be developed in consultation with system partners. All applicants must provide the following with their application: proof of language proficiency, as outlined in HSCPOA's language proficiency policy. In some cases, completion of PSW or other education in Canada or an English or French-speaking country is sufficient. Applicants can also make a declaration that English is the primary language and the language they use now, or they can provide evidence through a valid English or French language proficiency test. Applicants must submit government photo ID, such as a driver's license, passport, permanent residence card, or other government-issued photo identification. A headshot photo must also be submitted to confirm identification. This does not need to be professionally done and can be self-taken. Criminal record and judicial matters checks are required. Sometimes this is called an enhanced or a level 2 check and must be issued within 12 months of the date of application to HSCPOA. This is required to provide a comprehensive background related to the suitability to practice safely as a PSW in Ontario. HSCPOA selected the CRMJ checks due to some limitations of a vulnerable sector check. For example, a vulnerable sector check must be done at a local police station. CRJM checks improve accessibility for applicants, as this can be done online and is also very cost-effective. Like other regulatory bodies, HSCPOA will work with a vendor to conduct CRJM checks online if an applicant doesn't have a valid criminal record check within the past 12 months. To reduce barriers on applicants, vulnerable sector checks are also accepted if they are valid within the 12-month timeline prior to the date of application to HSCPOA. Applicants also have a responsibility to report additional information within their attestations and declarations on the application form, as well as an ongoing duty for mandatory reporting once registered with HSCPOA. Applicants must submit name change documentation, if applicable, for anyone who submits documentation under a different name than their current ID that was submitted. And letters of standing must also be submitted if an applicant is currently or previously registered with another profession or occupation inside or outside of Canada. Note that this excludes membership in a professional association. Depending on the pathway someone is applying through, they may be asked to submit additional documentation. Paths 1, Ontario Educated. Path 2, Option B, employed under 600 hours with prior PSW education. And Path 4, the Competency Assessment Pathway, are required to submit a certificate or diploma demonstrating that the applicant has successfully completed a personal support services education program and a transcript from their personal support services education program. Note, if the certificate or diploma or transcript does not confirm your personal support services education program was at least 600 hours long, including both class and practical experience time, applicants must submit other supporting documentation to confirm this. Path 2, Option A and B, the employer experience only and employer plus education, must submit confirmation of employment as a personal support worker skills form. This includes a form that's submitted by a current employer on the prescribed employer list, and this employer must have employed the PSW within the preceding 3 years before the date of application to HSCPOA. The form will include their practice hours, and the employer must verify that the applicant has a set of skills equivalent to a graduate of a PSW training program in Ontario via a checklist. Path 3, the labor mobility pathway, is required to submit confirmation of active registration with a current provincial healthcare aid or continuing care assistant directory or registry in Canada. Once we receive all the documentation to deem an applicant to have completed their application process, HSCPOA will endeavor to process this as quickly as possible. This may be dependent on the volume of applicants that we receive at any given time. We encourage PSWs to apply early once the application portal opens in November 2024. For more information about our registration, including the 4 application pathways, go to hscpoa.com and select registration information from the home page banner. HSCPOA also has frequently asked questions available on our application page on our website. HSCPOA will continue its outreach and engagement with system partners, now leading up to December 1st and beyond. We are currently working with an advisory group made up of personal support workers, PSW employers, and educators to develop a competency assessment process for Path 4. We are carrying out all the necessary work to prepare to accept applications for registration in the fall. The specific date in which applications will become open is to be determined. A call for expressions of interest will go out in October to recruit for the PSW Advisory Committee. PSW Advisory Committee appointments that will take effect on December the 1st once the regulations come into force. Note that any PSWs appointed will be conditional on registration with HSCPOA once we can begin issuing certificates of registration on December 1st, 2024. HSCPOA will begin registering PSWs on December 1st, 2024. We have a call to action for all PSW employers, PSW educators, Ontario Healthcare System partners, now leading up to December 1st and beyond. Keep yourselves informed. Ontario PSWs, educators, employers, and other system partners can keep informed by visiting hscpoa.com often. Help inspire others and raise awareness within your network of PSWs so they know what to expect beginning December the 1st, 2024, the benefits of registering with HSCPOA, and how to easily apply and register. Share HSCPOA's resources, including information sheets and handouts, frequently asked questions, guides, and upcoming videos at your upcoming events and meetings. Access promotional content on HSCPOA's website and watch for updates that are available on our website and by subscribing to HSCPOA's e-newsletter. Please contact HSCPOA for answers to your questions. Thank you for taking the time to view HSCPOA's webinar. Please feel free to connect with us via email with any questions. You can also refer to our website content for additional information. And if you haven't already done so, subscribe to HSCPOA News to receive timely and important information. You can also now follow us on social media platforms on Facebook, LinkedIn, and YouTube.